Welcome. Today I will be sharing some overlooked research that is incredibly important for those of us that are dealing with multiple sclerosis and other chronic diseases. I'm going to show you several studies that show that parasite drugs decrease relapses, how often they occur, significantly. They also decrease or slow down the progression to disability, and they also promote remyelination. If we haven't met, my name is Pam Bartha. I was diagnosed with multiple sclerosis over 35 years ago, and it is my mission to bring this important research out, to bring out the truth that multiple sclerosis is an infectious disease caused by parasites. And today we're going to be highlighting some studies that have been overlooked, that have not been followed up with, that are incredibly critical for helping us to understand, number one, what causes multiple sclerosis and what steps we need to take to recover. And we're going to talk about all of that in this live event. But before we get started, I wanted to just first share with you like a couple of the different types of parasites that we'll be talking about. So Protozoa might be something you're not familiar with. You might be familiar with worms, bacteria, fungi, but Protozoa are single-celled parasites, and they have been linked to multiple sclerosis. I actually did a 6-part series on Facebook and YouTube sharing a lot of research, a lot of evidence that over 100 years ago that they were actually treating MS patients with malaria drugs and having incredible benefits and improvements. And there was just a more recent study done we're going to talk about today. And then also what I have shared with you in previous live events and on our blog posts, our articles that I've written on livediseasefree.com, the different types of worms that our students are passing. They're passing a lot of roundworms. And then Dr. Alan McDonald found small roundworms in the central nervous system of every MS subject tested. He found developing tapeworms and tapeworm larvae in the central nervous system of every MS subject that he tested too. So these were people that they had died, confirmed case of MS. Their remains were preserved in brain banks, frozen for research purposes. He just looked and he found lots of parasites in the central nervous system. He also found Borrelia. So today we're going to talk about like 3 different drugs that have been shown to, 2 of them have been shown in multiple sclerosis patients. The other one have been shown in animal models to really benefit multiple sclerosis. So again, this is more evidence that MS is an infectious disease. So Protozoa are single-celled parasites. They're not a bacteria. They have more complicated structure than a bacteria would have, but they would be the types of microbes that maybe you've heard of: Giardia, Babesia, malaria. Those would be toxoplasmosis or toxoplasma, which causes toxoplasmosis. So those would be just a few examples of protozoa. And we are often infected with these protozoa through biting insects, and they cause diseases that are often misdiagnosed. So many of you may have heard of Babesia. It is one of the Lyme co-infections, and it is very, very similar to the protozoa that causes malaria. So they're both parasites, pathogenic microbes that infect our red blood cells, and they cause our red blood cells to become sick, and they stick together. They can form obstructions in our blood vessels, especially those little capillary in our different tissue, but also in our central nervous system. They can cause a rupture of the blood vessel. Then we can end up with a brain bleed. And what's really interesting with multiple sclerosis, I've shared this also, research shows that these lesions that we have are always centered around a blood vessel. They're not just randomly occurring throughout the brain. They are centered around, they're coming from a blood vessel. So, and then also these lesions, they have this ring of iron around the outside of the lesion. And they believe that that is from, if we have, let's say, a brain bleed, and we have a lot of red blood cells, and the red blood cells carry iron, so there would be a little deposit of iron around the outside edge of the lesion. So this is all research I've shared with you. So this all validates what I'm sharing with you today. So the key links with multiple sclerosis is that there's some type of malaria, babesia, protozoa that is one of the parasites that's causing the MS symptoms and causing us to be sick. And this is validated through at least 75 peer-reviewed science journal articles dating back to the late 1800s. And I'll share a little bit about the research there again. But if we look historically, since the 1880s, there were at least 75 peer-reviewed studies that were published linking some type of a protozoa, a malaria babesia type protozoa, to multiple sclerosis. In 1899, Dr. Manneberg proposed MS is caused by a malaria type infection. And in the 1920s and 1930s, malaria was in the United States. And so they were treating people for malaria with a malaria drug. And they were noticing that people that had multiple sclerosis had huge improvements in their health by using malaria drugs, like crazy. So that's another huge clue. And then Dr. Fry from Fry Laboratories, he discovered some type of a protozoa linked or found in multiple sclerosis patients also. So there's this trail of evidence that this is a major parasite in multiple sclerosis. Do all people with MS have this protozoa? I don't know. This is something that we are leaders in this research, bringing it to the forefront, making people aware of it. And we hope that you will join and become a wellness champion. And please help us to share the information that I'm sharing today. Share it with different groups. There is really an explosion in the general public of like, oh my gosh, that's why I feel so terrible. It's probably parasites. That makes so much sense. And yes, especially those of us that have neurological diseases, cancer, autoimmune, all of it is caused by different types of parasites. So let's look at the modern evidence. There was a study done in 2021, and they gave hydroxychloroquine, which is a malaria drug, to patients, MS patients that had primary progressive multiple sclerosis. And there were 35, I'll just say PPMS patients that were studied over 18 months, a year and a half. And normally they would see about 40% of the patients would worsen in their ability to walk. They would notice that their mobility would be worse. And with the patients that were taking the hydroxychloroquine, and this is primary progressive multiple sclerosis, the decline was only in 8 people. So the mobility was only decreased in 8 people versus what they would have expected for 14 people. So they would have expected at least 14 people, and only 8, their mobility became worse. So that was literally less than a 23% decline in the patients that were taking hydroxychloroquine. And remember, this is really important too, that they give hydroxychloroquine to people that have, I think it's lupus and arthritis, rheumatoid arthritis. And when they give hydroxychloroquine to these patients, they're not curing their disease. They're helping to manage it, to help it to control it. So we know that, and so like it makes you think, well, gee, I wonder if those people have some type of protozoa infection, and that's why this protozoa medication is working for them. I wonder. It probably is correct. But be aware, though, that when we're giving, or the doctors are giving hydroxychloroquine to lupus and rheumatoid arthritis patients, it's not curing them. So they're not giving them a dose that's strong enough to cure them. And I believe I don't know what the real reason is. I don't know if it's toxicity. Sometimes drugs can be toxic at higher amounts. I do know that hydroxychloroquine can impact your retina. So if you're ever going to use it, make sure that your doctor is checking your vision, your retina regularly. But it's really interesting that this malaria drug is so helpful for primary progressive multiple sclerosis when they really don't have any treatments for PPMS. And yet, is your doctor recommending it to you after this study? Nope. And this was just done out of the University of Calgary, Alberta, Canada. Shout out to them. Really great research. There's some really good research coming out of the University of Calgary with respect to the microbiome and multiple sclerosis. So really proud of them for that. So their conclusion is that hydroxychloroquine is a promising candidate for PPMS worthy of larger clinical trials. So this is a malaria parasite medication that significantly helped, and it wasn't given at a cure rate, it was just given at a maintenance rate, or like what you would do with other autoimmune diseases. And it was shown that it significantly helped PPMS. So if there's such different diseases, why would they all be helped by hydroxychloroquine? That is very interesting. So the key takeaways are that the benefits really far exceed any adverse effect of hydroxychloroquine, especially for people that have PPMS. And hydroxychloroquine slows, but it slows the progression, but it does not cure MS. So it slows the progression. But again, was it a curative rate for dealing with these protozoa? Because they're very difficult to treat, especially when they are in your brain. When we have something like malaria, or I should say cerebral malaria or cerebral babesiosis, or a similar protozoa that gets in the central nervous system. Not all drugs cross the blood-brain barrier. So, but to truly recover, right, we have to use more effective treatments for a malaria babesia type infection. Again, please be aware that hydroxychloroquine can affect your vision, like your retina. So make sure that if you are using that with your doctor, that they do double check to make sure that your retina is safe. They have to check your eyesight. Let's talk about another parasite drug. So this is Levamisole. It is not available in the United States. It is available in Canada. I believe it's fairly safe. When I looked back on it years ago, they banned it in the United States because when they were mixing Levamisole, like the illegal drug trade, they were mixing, I don't know why, but they were mixing Levamisole with this illegal drug to get high, and it was killing people. And so they decided to stop Levamisole or not make it available in the United States, which is insane to me because there's a lot of other drugs that have much worse side effects. This has a huge benefit in treating parasites. And when it's used properly, it's not going to be a problem. But we have many, many people that are overdosing on all kinds of drugs that, like in Canada, it's really awful. I'm not even going to go into it. But this study, the name of the study, the title of the study is called Modulation of Immunity in Multiple Sclerosis, a double-blind Levamisole placebo-controlled study in 85 patients. The study was done in 1982. Over 3 years, there were 85 patients that were enrolled, participants in the study, double-blind, placebo-controlled. So that's a good study, double-blind and placebo-controlled over 3 years. And there was a group of patients that received either Levamisole, and then there was also a control group that received a placebo. So they did not receive the parasite drug. And Levamisole is a parasite drug that treats worms. And the people in the study group were given, and this, of course, the researchers didn't know who got the Levamisole, that's the double blind. And the people didn't even know if they were getting, the patients didn't even know if they were getting a placebo or Levamisole. So nobody knew, but some of the patients were given Levamisole and others placebo. Levamisole restored the T cell function, which is awesome. And when I'm saying about like restored T cell function, it's like, it's not that it's so wonderful that it actually goes in and fixes your T cells. It's that it took away the stressor of the T cells. So the T cells were not overreactive. We're not having to work so hard. So it did something to restore T cell function. And the placebo patients, they declined significantly. The Levamisole patients remained stable. So they were only given this Levamisole once a day for the first year. And then after that, they received one dose per week instead of daily. So it wasn't that they maintained it once a day for 3 years. They did once a day for 1 year. And then for the last 2 years, it was once a week. They received this parasite drug. So huge that the placebo patients declined significantly and the Levamisole patients remained stable. That's so huge. And this was, again, double-blind placebo-controlled study. So the relapse rates and disability scores, they stayed more stable with Levamisole, which is wonderful. Another study, so this is study number 2, talking about Levamisole and multiple sclerosis. This was a 4-year double-blind placebo-controlled study of Levamisole in multiple sclerosis, and it was done in 1991. This was done over 4 years. They had 41 patients, again, double-blind and placebo-controlled, and the Levamisole was given once a week. So normally when our students are treating parasites, they're treating, like, depending on the drug, it's never once a day. It's twice a day, 3 times a day. So these patients were only given once a week. 36% of the treated patients versus or relapsed. So 36 of the patients that received Levamisole, they had another attack, they relapsed, versus 74% of the patients that had the placebo relapsed. So like it's almost double the people that did not have the parasite drug, they had a relapse, versus the people that did. Could you imagine if they were treated like effectively with Levamisole? And a little side note here is that with our students, we know that the parasite drugs aren't perfect. And when we're treating parasites, we usually have to take multiple parasite drugs to clear the parasites. And we're using oxygen therapies, we're using herbs, and we're using like 3 to 5 parasite drugs. So for us to see this much, like almost a 50% reduction in the relapse with this parasite drug is quite shocking. It's amazing. That's huge. There's no MS drug that does this. So it's just absolutely amazing. There were some minor adverse effects. Sometimes if you're treating worms that you might feel a little nauseous. You might not sleep as well because the parasites are not happy when you're treating them. Some people had a little bit of dizziness, but they were not serious, not life-threatening, and really short-lived. So originally this was a deworming drug, and that's what it still is for roundworms and hookworms. Interesting though, this morning I just did a quick Google search to see, and I'll look more into it, but there is at least one study showing that giving people, or that it's helpful against malaria also, which is crazy. So one study showed that Levamisole definitely improved malaria in patients. So it's not the first line of treatment, but again, that might explain, like if somebody had malaria babesia and they used Levamisole, maybe it's not the most effective treatment at treating that parasite, but it can be helpful. So yes, we have roundworms. Yes, we could have hookworms, but maybe it is also discouraging other parasites if we have the Protozoa. And so this drug, Levamisole, was shown to be like immune modulating effects. That was already discovered in 1971. And also it's been studied for MS, but also Levamisole has been studied in different cancers, rheumatoid arthritis, and lupus. Interesting, eh? Here we see the lupus and rheumatoid arthritis again. And the FDA withdrew it in the year 2000 due to contamination in cocaine. So like if somebody's using cocaine, and I don't know why they would mix Levamisole with it, but I mean, I don't understand. That does not make sense that would be a good reason to get rid of a safe drug that could be used when used properly. It's incredibly helpful, more helpful than the MS drugs appear to be. So why is that not being allowed? If you use any drug unsafely, it can cause terrible adverse effects. So why don't they just outlaw all drugs if they're not used safely? But in many countries, it's still available. So make sure to type your questions in the question box. Myself or our team will answer your questions at the end. So, and the last one I wanted to talk about, the last study, is Ivermectin and remyelination. So this is an animal study. They looked at the MS model. It's really interesting. Like, how do they give mice some type of MS? And it's interesting. I won't go into this talk, but like they don't know what causes MS, but they can give mice MS. Like, how does that work? So this study is P2X4 receptor controls microglia activation and favors remyelination. So in a nutshell, microglia are immune cells in our brain that help to regulate inflammation and tissue repair. So they're part of the immune system in our central nervous system. And the results or the conclusions they found are that microglia are turned from their pro-inflammatory state into the anti-inflammatory state with the use of ivermectin. So immune modulatory. So is it, anyhow, we won't get into that, but basically it is an anti-inflammatory state that it's making the immune cells go into. And that, like if the immune system is not fighting so hard, then it can go into the repair. So it enhances myelin repair, and phagocytosis just means that the immune cells are just gobbling up the garbage, cleaning up the garbage. It's a cleanup crew, and it improves clinical outcomes in MS models. So this showed that ivermectin, they felt, would be a candidate for remyelination and repair in multiple sclerosis. So with our students, we don't find that ivermectin is like the end-all be-all cure. It is used in conjunction with other parasite drugs if people test well for it, but it's not the main help. But I just wanted to share that with you because people are talking about it. They're asking me all the time about ivermectin, does it remyelinate? No, your body remyelinates, right? Your body heals and repairs itself. When you take pressure off the body, when you take pressure off the immune system, then it can do its job and it can remyelinate. Obviously, it does need the building blocks, the nutrition to remyelinate. And I've talked about plasmalogens, how we become deficient in plasmalogens, and they're really important in building myelin. So that's something we can do to correct nutritional deficiencies, but we need to treat the parasites also. Yes, this is, when somebody's asking here, a cure. So what I would say is that I think we have to start thinking differently. And what I'm saying is recovery. Like people can have full recoveries, but you can get parasites again in the future. So you have to make sure you never let it get to this position again. And that's the important thing to understand, is that in curing, it's kind of like you can't live on planet Earth and be cured of everything forever, because there's always this, they're pests, just like there's pests in your garden and there's pests in your animals, like you have to deworm them. There's pests in your lawn. There's going to be pests that are trying to invade our body and trying to make us, they're not trying to make us sick. They're just trying to live in us, live off of our food. They're freeloaders. And so instead of saying curing, I think we should say recovery, because we can recover from these parasites and then we can stay recovered by making sure we never let them become this populated in our body again. But what I've shared with you, these 3 drugs, hydroxychloroquine, Levamisole, and also ivermectin, they are all showing, and this is in science, this is not me anecdotally, they're saying that can decrease or slow down the progression to disability, and also act as immune modulation and just really decrease relapse rates. Those are really, really significant. So why is this not being studied? Why are there no follow-up studies to prove them wrong? Again, 1991 studies, 1982, those are a long time ago. Why has there been no follow-up study on these, on Levamisole, for example? Another thing I shared with you too is that, if you've had pets, that there's a greater risk of having multiple sclerosis, and also people that have MS about 5 years before they're diagnosed, they have a very high risk of having all kinds of bowel issues, whether it's constipation or it could be incontinence, gas, bloating. So there's just a mountain of evidence showing that MS is caused by parasites. And I hope that you really share this video and share our blog post, like make sure that you're on our part of our community and on our list. Go to livediseasefree.com and you'll be getting our newsletter where I share all of this research. if you're new to all of this, is the first time that you've found me and you're like, what? Parasites, Pam? Seriously? Then go to our website, livediseasefree.com, under blog posts. Those are the articles that I write, and they will always have the shorter version of these videos. And there you can actually, it's just a gold mine of just a library of such important information where you can just dive into it and you'll really start to understand what you're dealing with. A student that's joining, I was talking to him today. He's like, yeah, I saw some of the parasite pictures that you've shared. And he's like, oh my gosh. And people are like, well, could that be me? Could that be in me? Yeah, it can be. They're part of life and they are really linked with multiple sclerosis. I haven't seen one MS student that I've worked with that does not have large worms. And remember, it's not always the large worms, the protozoa, the bacteria that cause Lyme disease, the fungi, they're all involved. It's like a very weedy lawn, and that's what's inside of us. So going back to these studies, before I do that, I just wanted to share like some symptoms of protozoa and malaria type infections, which are really relevant to multiple sclerosis. So maybe you don't have the fever or the chills, but definitely a lot of people have the sweats and headaches and nausea, fatigue, body aches, anemia, sometimes liver or spleen can be enlarged. You can have low platelets. Also the red blood cells, like for me, that was another big clue, is that decreased red blood cells. Sometimes they're larger. So your MCV and MCHC, all of those red blood cell test results can be a little bit off. Anemia is really common. High bilirubin, sometimes looking a little bit like your jaundice, especially in the wintertime. And then seizures, coma, respiratory distress, kidney injury. So those are more severe malaria. We have more chronic Babesia malaria, where it becomes cerebral, it gets into the brain. We can have hearing loss, tinnitus, dizziness, paralysis, muscle weakness, spasms. Those are all linked with, yes, the malaria Babesia type protozoa, but also with other parasites, especially things like Borrelia, which causes Lyme disease. So we know that with malaria or a malaria-like protozoa, that they definitely impact our red blood cells. They definitely can get into the central nervous system, and I believe that they're very significantly involved in multiple sclerosis. So they make our red blood cells sticky, again, cause the blockages in our blood vessels, and then we can have these ruptures and we can have brain bleeds. I've even done a talk about how MS is considered more of a vascular disorder. This is in the research again, and that would help make sense, because if your red blood cells are sick, you're going to have a vascular disorder. Otherwise, it's like another mystery, right? Why do we have a vascular disorder? So there is a mountain of evidence, and if you go to our blog post on Live Disease Free, you're going to see, you can just look at the titles, you can scan my notes, it goes really fast, and pick the titles that are really important to you or that you find interesting. And then also make sure to check out the Live Disease Free diet. That is free on our website under research, in the main menu under research. Start changing your diet. I had one person tell me today, like 3 days of being on this diet, and not perfectly because he doesn't have my counsel yet, but 3 days, and he's already noticed that his bladder has improved significantly. And isn't that nice? Because when your bladder improves, then you can sleep better. You're not getting up throughout the night, and then all the other symptoms start to improve also. So with respect to the protozoa, there's over 100 years of studies that are pointing to that being one of the types of parasites that cause MS. And with all the evidence, what I'm going to do now after this talk, I'm going to start going through all the evidence relating to the protozoa and also to the small filarial worms, to the tapeworms, to the fungus, to all of the Borrelia, like Lyme disease, all of these different topics of the different parasites, sharing with you research and also successes of people that are treating these parasites and recovering. So if we want to recover, like these studies are helping us to see the potential of like, interesting, these parasite drugs are working better than MS drugs, and with all of the other evidence Pam shared, but we want to recover, right? That's similar to curing. We want to fully recover. We want to live a full life like I have for 35 years without having to take MS drugs, without having to worry about relapses. But you can only do that when you treat these parasites effectively, not just taking low doses, not just winging it. Oh, I'm going to try Ivermectin. I'm going to try this or that. You're still going to live with disease, right? How bad do you want to recover? You need to treat the root cause. You need to use an effective, safe protocol based on the parasites that you have. And unfortunately, a lot of our practitioners don't have this experience at this time. This is going to change. I'm going to be part of helping this to bring change. We want our practitioners to be able to have the experience, the confidence to help their patients recover from parasitic infestations. And we have to use a holistic approach, right? The parasite drugs are not a magic cure. Herbs are not a magic cure. We use a combination, but we support the body, we build a healthy lifestyle, and we treat the parasites strategically by layering on different therapies. And we have to also work on mindset, like all those other things that you know that if you've been working on your health. Supplements, we don't take a ton of supplements because they're not really helpful. Just a few short, small, key ones that can be helpful. I'm going to go to your questions. Hello, Lorraine. Hi, what is new in MS? Well, it depends where you're looking. If you're just looking at standard of care research, it's, we have this new immunosuppressive drug that destroys your B cells, and it's different than the other ones. It's just got a different name. That's what's new in MS. It's crickets when you're looking at the microbiome in multiple sclerosis, but there is no money in figuring out which parasites are causing MS. There is no money in, trying to prove Dr. Alan McDonald correct or wrong. They just don't even go there. Dr. Alan McDonald did the profound research. He should get a Nobel Prize for that. He didn't spend millions of dollars. Yes, it does cost money to research, but you can do it realistically where you're not spending millions and millions of dollars doing it. Like, you just take the resources from these brain banks, look at it under the microscope. Maybe you have to examine it over a month or two, using different stains, looking for different things, but it's not that hard, right? And they're not doing it. Nobody's doing it because there's no money in treating parasites. And that is the unfortunate thing. So we can either just sit back and wait for a cure, which will never happen in our lifetime, or we can take a different path. I was really fortunate that when I was first diagnosed with MS over 35 years ago, I decided to take a different path. I read 4 books by medical doctors that said that MS and all chronic diseases were caused by infections in the body. And I decided to take that different path. It made sense to me. I didn't totally know that I'd be able to live MS free for 35 years, but by the grace of God, I have, and He has really leaded and guided me and our students into an amazing system of recovery. So number 1 is stop feeding the parasites. They love carbohydrates, so decrease that significantly. Number 2 is to support the body. Make sure that you're feeling a lot better, that your detox pathways are open. Number 3 is to start treating. And we use a combination, a layering of therapies, which would include parasite drugs, herbs, and oxygen therapies. And then number 4 is, once we've recovered, is to continue building that healthy lifestyle, building up the healthy microbes, our natural defense that protects us from these parasites, and periodically treating parasites just like we do in our pets. Very important. Sometimes it might warrant once a year, twice a year, 3 times a year. But that is really the key. That's the missing piece that we have been missing for so long. There's all this study and talk about, the microbiome and the interest in it. But they're talking about bacteria and viruses, but they're not talking about protozoa and worms, which are the biggest culprits that are making us sick. So unfortunately, there is not a lot of good news in multiple sclerosis. So these studies are older, but nobody's willing to follow up on it. And why is this not being studied? Deb is wondering. Well, if you are on a MS medication, you know that they are at least $100,000 per year. That's what they're being billed out as. And so if your doctor was to, and I'm not blaming the doctors, I'm not saying they're intentionally not treating parasites. They just have not been trained in parasites. They do not have good tests. They don't know what they don't know. But at the top, who's running this whole healthcare industry, they do know. And unfortunately, they've chosen profits over curing people or helping people to recover. Their profits are more important than treating the root cause. You know, and I know it's like a multi-trillion-dollar industry, the healthcare industry right now. It's not sustainable. People are not recovering. They're not getting well. They might cut out tumors. They might hit the immune system, but it's not effective. None of it is effective. And so that is why if you like that approach, continue on. But if you don't, you have to take a different path like I did. So Lorraine, if I join the program, is the Levamisole available in the US? Well, no, but it is not one of the main ones we're using. I'm just sharing with you. So there are multiple parasite drugs that treat roundworms, and maybe that one isn't available in the United States, but I'm just sharing it with you so that you understand that parasite drugs in general help multiple sclerosis significantly. And so it wasn't just Levamisole, it was and we don't even use hydroxychloroquine in our students, because it's like, why use a drug that doesn't cure you? Why not use a drug or several drugs and treat the root cause more effectively? So why take a drug ongoing like somebody with lupus or rheumatoid arthritis for years and years and have to worry about that your retina is going to be damaged? So you will be able to access the parasite drugs that you test well for that will treat roundworms and tapeworms and flukes if you have them, and things like Protozoa like Babesia and malaria, whichever Protozoa you're dealing with. But also a lot of people with MS, they also really usually have like the spirochete that causes Borrelia. But they could also have Bartonella. There's a few different infections. So yes, you can access all the treatments, but in the United States, not Levamisole. And honestly, most of our students, even in Canada, we can access it, but we're not using Levamisole. Lorraine, all the seminars are so interesting and convincing. We always have our pets, our cats and dogs, rabbits and birds. Yes, and that is a thing that, make sure you're deworming your pets. I deworm horses, dogs regularly. We had sheep. We were going to deworm them, but we decided we're just too much on our plate. But it's very important to deworm your pets and use practices that decrease the contamination of. So like we clean up the manure from our horses. Just make sure to manage the manure, manage the stool from your dogs and cats, and make sure that they're kept away from children and away from yourself. If you can have your animals outside, we're at that point now. We used to have a dog in the house. We don't anymore. We have dogs that love living outside. So that's what we do. But we still have animals in our life. We still love them. And it's not just animals that we get the parasites from. It's from produce. It's from working in the garden, right? They're all over. We can eat in a restaurant and somebody has parasites. They didn't wash their hands and they can contaminate your food. You can't hide from parasites. They're part of life, but we can treat them. Hi, Noelle. How do we do a parasite cleanse? Well, you can use herbs, but we have found that if you're a super healthy person and you just have some gas or a little constipation, you can just use herbs. But we have found that just the herbs on their own are not enough to clear a parasitic infestation that causes chronic disease. So if you have any kind of chronic disease, autoimmune disease, the parasite drugs are really helpful. We do it in cycles. So we find out first of all, we get ready to treat. Then we find out which treatments test well for us. And we cycle from big parasites to small parasites. The cycle is about 4 to 6 weeks, and we do multiple cycles until we are completely symptom-free. So Lorraine, my daughter's red blood cells are large and sticky. So that's a really big indication that she probably has a parasite in her red blood cells. And I don't know if it is malaria or babesia. Nobody's bothered to check, but it is something similar to that. They're treated the same. She's had MS for a long time. Can she still be helped? Absolutely. If she's using a scooter, let her see Terry Walls. Not Terry, pardon me. It's a different Terry, not Terry Walls. Terry, on our website, livediseasefree.com, under this Wellness Champion Successes, you can see Terry, who had MS for, I think she was in a scooter for 8 years. And not everybody comes out of the scooter as quickly as she did, but she literally was out of the scooter like 3 or 4 months after starting to treat, which is crazy. And then she had to, of course, use crutches, and she was doing leg squats in the doorway. She was on her exercise bike, and then you can see her standing. So amazing. So we've had students that come out of wheelchairs, but it's number one, how well and how effectively they implement the steps. The steps are easy, but you just have to implement well. And then it's just how effective you're treating. So, and we are seeing much more recovery than we ever thought possible. It's just crazy. I really suspect that a lot of people are going to have way more recovery than they ever thought possible. If you've had HSCT therapy, do you think you still need to detox and take parasite drugs? So the problem with the HSCT is that it's attacking your immune cells. Your immune cells were never the problem. So this is another, so we're using MS drugs to attack our immune cells. We're using HSCT to attack our immune cells. When you have a parasitic infestation, when you have the enemy is just infested in your body, and then you're hitting your soldiers, yeah, the drugs you're taking for the chemo, like to knock out the immune system, will definitely be negative to the parasites, but it's not an effective parasite treatment. So, Paula, what we're talking about is helping you to treat the root cause, to recover and be a normal, healthy person. HSCT does not do that. It targets your immune cells, and your immune cells are not the problem. That's the whole difference. You're so welcome, Lorraine. So a couple more questions here. Shelley, I can't talk about that, Shelley. That is a very heavily censored topic. You're very welcome, David. So in conclusion, today I've shared with you 3 parasite drugs that significantly help decrease relapse rate of MS. They also slow down the progression in primary progressive multiple sclerosis, and they have been shown in, like Ivermectin, been shown to help remyelination. So these are parasite drugs. Like, how is it that 3 different parasite drugs are helpful for multiple sclerosis? Could multiple sclerosis be a parasitic infestation? Absolutely it is. This is a very small amount of evidence. I have provided a mountain of evidence. I will keep preaching this until the world changes, until we actually are helping people to recover and treat the root cause. And you can help me by sharing and liking and subscribing. That is what tells YouTube and Facebook to like share this to other people. Please type in your questions in the question box, and make sure that you go to livediseasefree.com. There you will find that you can be part of our community, and you can actually get the newsletter, so you'll have all the most recent research. And if you're at that place, you're like, Pam, I've been following you for a while. I totally believe I'm dealing with parasites. I need the plan. I need the Live Disease Free plan. I need your support. I want to recover. I want to get on with my life. This is my year. Then make sure to watch my masterclass training. I go into all the steps of what we do in the Live Disease Free plan to recover from these parasites. And then if it's a good fit for you, then you can book a time chat with me, and you can get all your questions answered. And I would be honored to support you. So with that, I'm going to let you guys go, and we will talk to you next week. Take care and bye-bye for now.